IT band syndrome is a very common condition where you get pain on the outside of your knee. It typically will occur in runners and it can be very, very painful to the point it will stop you from running. So in this video, I'm going to show you how you can get to the cause of the problem so you can actually fix this for good. Let's begin. Hello, my name is Dr. Stephen Hulme. I'm a chiropractor based in Reading, and in today's video, we'll be talking about IT band syndrome. So to start with, what actually is the IT band? Well, the IT band is basically a cord or a piece of ligament that goes from the outside of your thigh down to your knee. Its purpose or function is to transmit force from your hip to your knee, and the main functional unit is going to be the tensor fasciae lata, which attaches from the upper part of your outside of your hip. And so then the IT band is something that attaches from the TFL and then down to the outside of your knee. So it does lots of different functions in terms of moving your hips and your knees, and it's also a very common area of the body to get very tight, particularly in runners. When this band gets excessively tight, it will get to a point where it starts producing pain, and quite often this is going to be around your knee. Now, the reason why you get the pain on the outside of your knee is because the band goes over a piece of bone over your knee, and so every time you flex and extend your knee, the band starts rubbing over this band, starts to get inflamed, and that's why you get the pain. And this is why you tend to get it in runners, because running, the action of running, you're continuously flexing and extending your knee in a very constant fashion, very consistent fashion, and so that inflammation or that rubbing, that friction over the knee can start to build up, and to the point that you have to stop. And as soon as you stop, that pain will then tend to subside. The question we've always got to ask ourselves in this kind of issue is, why is this fascia tight in the first place? And it typically comes down to dysfunction of the glutes in this case. I've talked a lot about the glutes in my previous few videos, and this is one of the outcomes of a weak glute. And the reason why this is the case is because one of the functions of the IT band is to abduct your hip, so to bring your hip outwards. One of the functions of the glute medius and minimus is also to abduct the hip. If the glute is not functioning properly, if it's not turning on, if it's not activating, if it's too weak, then other muscles have to do that job for you to be able to use your hip properly. And so the TFL quite naturally will do that job. And that TFL, remember, is attached to the IT band. Over time, because it's not designed to do that job to that degree without the glute medius, it will start to get tighter and tighter and tighter. And this might occur over a long period of time to the point that it goes past that threshold and starts producing the pain. So what do we need to do to fix this issue? Well, we don't want to just stretch this muscle. We don't want to just foam roll it, because we're not going to get to the cause of the problem. Yes, you might get some relief in this, and I wouldn't suggest not doing this. You can still do this and it should still help. But if this is all that you do, it's a good chance that this is just going to come back. The best thing to do is to go see a chiropractor, an osteopath, a physio, somebody that can assess you and actually confirm this diagnosis, and also confirm that it's because of a weak glute. Now, most of the time this is the case. However, it's not always going to be the case. Now, once you can confirm that it is because of a weak glute, then you can start strengthening this muscle. Now, even if you can't go to a chiropractor, you can't confirm that diagnosis, it's still worth doing these exercises, because the likelihood is it's because of a weak glute. So you may as well try it, and there's a good chance that you're going to see an improvement in this area. Your glutes are very typical muscles to get weak, and so strengthening it can help many different areas of the body, not just where it's located. Now, to find some of the best exercises to strengthen this muscle, I highly suggest go check out this video here and just follow these exercises. If you follow these exercises, this should, in most cases, help this problem. As I mentioned in this video, you don't just want to strengthen this weak muscle, you also want to stretch the antagonist muscle if it is tight. And in a lot of people, this is tight. So your antagonist, so the opposite muscle basically to your glutes, is going to be your adductors, or that's specifically at least to your glute medius and minimus, which is going to be specific to what we're dealing with here. So you want to stretch your adductors at the same time as strengthening your glutes, and this is what I go through in this video. So check out this video to get to the bottom of the problem, but it also is worth going to see the chiropractor because they can assess your knee, your hip and your low back to check for dysfunction, restricted joints, for movement patterns. There is a lot more that goes into this, as well as prescribing you some exercises, but the glute exercises are going to be the main thing to resolve this problem. So I hope this is helpful. Please do put any questions you have in the comments below, and obviously don't forget to subscribe for more videos like this one. Have a good rest of your day. Take care. Bye bye.